Hi, my name's Scott Faber with the Environmental Working Group. Thank you for joining us. Per and polyfluoroalkyl alkyl substances, or PFAS chemicals, are a family of thousands of chemicals used in consumer goods and industrial applications. We're exposed to PFAS through our food, through our drinking water, and through everyday household products, including everything from cosmetics to clothing to carpets. These chemicals have been linked to serious health hazards, including increased risk of kidney and testicular cancer, increased cholesterol, low birth weights, increased risk of high blood pressure or preeclampsia among pregnant women, and harm to the immune system, including decreased vaccine response in children. We call these synthetic chemicals forever chemicals because the carbon-fluorine bond that is the primary characteristic of PFAS makes them extremely persistent both in the environment and in the human body. In other words, that means they never break down once they're released, and they stay in our bodies for a really long time. For decades, companies like DuPont and Saint-Gobain have discharged PFAS into our air and water, but these are not the only companies discharging PFAS into the environment. At least 2,500 industrial facilities across the nation could be discharging these toxic fluorinated chemicals into our air and water, according to a recent analysis of government data. And there are currently no restrictions on these industrial PFAS discharges under the Federal Clean Water Act or the Federal Clean Air Act. Congressman Chris Pappas is leading efforts to finally restrict industrial discharges of PFAS. His version of his bill, the Clean Water Standards for PFAS Act, was included in legislation, the PFAS Action Act, which passed the House in January, and Congressman Pappas is leading efforts to include the Clean Water Standards for PFAS Act in must-pass water legislation, the Water Resources Development Act. No one has worked harder to make PFAS pollution a priority for Congress than Congressman Chris Pappas. So it's my honor to turn this event over to Congressman Pappas.
Well, thanks very much, Scott, for the introduction and the kind words. And want to thank you and the Environmental Working Group for just being a tremendous partner on the policy side. You all provide us with the resources we need to wage this fight in the halls of Congress. So thanks for all your efforts and all your help along the way. Here in New Hampshire, we have seen PFAS contamination in our cities and towns. It's due to the tireless advocacy of people that are joining us on this Zoom here today, Laurene and Andrea. It's due to them that policymakers have been taking notice in our state and really across the country. And because of their work, New Hampshire has taken some significant steps forward, including stricter standards to protect our drinking water, something that we have long fought for and achieved here in New Hampshire. As someone who has been working on these issues in Congress, I've learned from Laurene and Andrea and so many others across New Hampshire about the clear and present danger that PFAS represents to our country. And I'm really proud to help lead this fight in Washington. We've got a strong bipartisan group that are members of our PFAS task force. We're building coalitions to get legislation passed through the House. And we've got to do all we can to get these ideas over the finish line into law and to hold polluters accountable, to protect the health and well-being of the American people. An independent analysis recently showed that over 2,500 industrial facilities are likely discharging PFAS directly into our waterways, as Scott mentioned, or indirectly discharging toxic chemicals through their wastewater. So today there are no federal standards in place that would prevent this from happening. And when I heard about it as a member of the Transportation Infrastructure Committee, I decided to introduce legislation. I think this situation is completely unacceptable. And we're working hard to make sure we can get the support we need in Congress to regulate these industrial polluters who put toxic chemicals directly into our water, who poison our neighbors, friends, family members, and communities. So there are simple things that we can be doing today to continue to press these issues and to take steps forward. The EPA has long had this quote unquote action plan that they haven't acted on. And we need to see national drinking water standards that will keep people safe from PFAS. And we've got to prevent it from being emitted into our air and dumped into our water and our environment. So, I think that we have a tremendous opportunity here, especially in the next Congress, to make significant progress on these issues. The more that members of Congress hear from people in their districts, the more they learn about this issue and the more they're likely to join our coalition. So we really have an opportunity here for activists, scientists, public health officials to weigh in and help move good policies forward. We're going to look for any opportunities we can in Washington to try to get this right, because really there's nothing more important than protecting the health and safety of the American people. So I think the cost of inaction here is too high. I know the folks on this call agree, and I'm really glad that we could all join together for this effort. Now, we've got a champion on the line with us here, Mark Ruffalo, who's familiar to all of you. He is an actor and a producer. He's testified before Congress. He's traveled all around the country bringing specific attention to this issue of PFAS contamination in our communities. And I'm really pleased that he had the time to join us here today. He's got a great film out, Dark Waters. You should all see it if you haven't checked it out yet. And what you'll learn from that film is that this is a problem that has been here for decades and decades. And our government has done nothing while people have been poisoned. And if not for some folks in the health and legal community identifying this and bringing this forward, we wouldn't even be where we are today. So Mark, we appreciate your activism, and I'd love to turn it over to you.
Thank you, Congressman Pappas, and thank you for your deep knowledge of this this issue and the hard work you're doing. I mean, the choice is clear with you in leadership that this issue and the thousands, tens of thousands of families that are being poisoned right now today from these chemicals that are directly linked to 7 different major illnesses will have some kind of regulation and some kind of oversight. As you said, we have no oversight right now. As you know, you talked about the movie. I played Rob Bilott, who was the lawyer who uncovered this mass poisoning in the movie Dark Waters, where DuPont knowingly discharged toxic PFAS into the air and water in Parkersburg, West Virginia. And what's amazing to me after all this, we're talking decades from the 50s, is that nothing's happened. You know, companies like DuPont have known since the 50s that PFAS would build up in our blood. They knew in the 60s that PFAS was toxic. They knew in the 70s that PFAS was harming their own workers. And they knew in the 80s that PFAS was contaminating the tap water of nearly every nearby community. What's amazing to me is that DuPont can discharge these chemicals into our air and our water right now, even as we're having this event. That the EPA has known about these risks of PFAS discharges for decades and has done nothing to regulate the discharges under the Federal Clean Water Act, as you said. And that's still, you said 2,500 companies are probably discharging PFAS into the water and air right now with absolutely no oversight. We know that it builds up in our bloods, in our bloodstream, in our organs. There's serious health risks. And for whatever reason, this has been one of the best kept secrets in America. We have military bases and families all over the United States who are being poisoned, have been poisoned for decades, whose families are sick and ill. And we have the Department of Defense completely ignoring it, trying to act like this isn't happening. And people's lives are really being affected. So who's going to pay for all this? Who is going to pay when we fail to act? Right now, it's us. Our healthcare costs are going to us, or it's offlaid to the public for this this insanity, where we have to clean it up ourselves. If we find it in our water, we have to pay for filtration. And at this point, there's still no one but people like you, thank God, that are willing to go and fight for this. So that's why I thank you for your bill to restrict the discharges of PFAS. It's so important. And I thank you for your leadership, Congressman. You know, we need more people like you. And there's a clear and stark difference between you and your opponent. And I hope that the people listening and watching today understand this. Whatever's coming out of that side is nothing but lip service. We had a chance, we've known this movie came out, there was a chance to really pass some serious legislation on this in these last 4 years. More public people, it's been more on the public than ever before. This administration touts how they're into clean water, but we still have the dirtiest water in this nation that we've ever had in our history, including lead and PFAS. So I'd like to turn it over now. Thank you for your leadership, and I'm gonna throw it back to Scott Faber, who's doing such great work on this.
Thanks, Mark. And I just on that point, EPA could today restrict these industrial releases. They have the authority under the Clean Water Act, and they just, under the Trump administration, have chosen not to. And that's why Congressman Pappas's bill is so important, is it would just force EPA to use the tools we gave them 50 years ago when we passed the Clean Water Act. So, well, now it's my great honor to pass it on to two great local advocates who've worked tirelessly to address PFAS pollution in their communities, Andrea, Amico, and Laurene Allen. So I'm going to throw it to Andrea and then Laurene, and then we want to hear from you. So if you do have a question or comment, put it in the comment section of your Facebook page, and we'll get to that right after Andrea. We hear from Andrea and Laurene. Andrea.
Thanks, Scott. Thanks, Mark, and thank you, Representative Pappas, for being here today. Yeah, my name's Andrea Amico. I co-founded a group called Testing for Peas, and we started back in 2014 when my community learned that we had been exposed to PFAS chemicals from the former Peas Air Force Base. You know, my heart sank when I first realized that my kids were drinking contaminated water. It's just absolutely heartbreaking. It's something I struggle with every day, and it's something I worry about all the time. But what I've tried to do is really channel that energy and those feelings of anxiety into something positive. And back in 2014, we were one of the first communities to discover this. We didn't have a lot of knowledge about PFAS. We didn't have a lot of champions helping us at the time. And we worked really hard in my community to advocate for a blood testing program, which then led us to working with ATSDR and advocating for a health study. And I'm really happy to say that my community is going to be the pilot study for ATSDR and the health study, which has been amazing. And the Air Force, we're fortunate here, the Air Force is taking action and cleaning up the contamination. But I quickly realized as a couple years went on and more communities were finding their contamination, like Laurene and Merrimack and many other communities across the country, that most communities aren't getting what I'm getting here at Peas. You know, they're not getting access to blood testing. They're not getting access to filtration of their water. And they're certainly not getting access to health studies and more information. And it's mind-boggling to me that 6 years later, there's still so many communities that have been left behind. There's still so many communities who are fighting for clean water and fighting for medical monitoring and guidance to their physicians. Why this isn't become more mainstream is, you know, beyond me, but something that I'm incredibly committed to, and incredibly committed to working with other communities to help educate them and advocate with them for change at the federal level, but then also working with leaders like Representative Pappas, who will put legislation in place, who will meet with communities and understand our needs, and then go and create laws that help people like us. And we've been very fortunate here in New Hampshire to have a very strong congressional delegation to help us lead the way. And we need to continue to elect leaders that are going to help us make change. The EPA has certainly let communities like mine down, and many across the nation. We need people that are going to trust science. We need people that are going to listen to public health experts, and we need people that are going to put the needs of communities first, not profits over people. And so I'm incredibly grateful for this opportunity here. Thank you for everyone on this panel for all that you're doing to help people like me, my children, and the rest of us across the country facing this issue. Thank you so much.
Great, thank you, Andrea. Laurene.
Oh, good afternoon, and thank you all so much. This battle, and it is a battle, is immense. In March of 2016, I found out with members of my community that we had been exposed to PFAS. PFOA in particular was focused on in our drinking water for many, many years. The questions that we asked were inadequately answered. People instinctively knew that this was harmful. They looked at the lack of information that was there. They did their own research, and they found out that these chemicals are bad news for all of us, as we know. So what we have found since 2016 is we have a polluter in the midst of our community, which is approximately 27,000 people. It's a really absolutely wonderful community. And since 2003, there's documentation on file over issues with air emissions. So the air emissions from Saint-Gobain in their facility where they manufacture PTFE coating. PTFE is Teflon, for those of you who don't know. So the fabric coating is going back to the beginning. The documentation of issues with air emissions is going back to at least 2003 is problematic. A corrective action plan was in place at that point, 15 years to reduce emissions. That is outrageous. That is outrageous. So as we learn about these chemicals in the forever qualities, we realize that these emissions have led to soil contamination, have found their way into groundwater. So 47% of New Hampshire receives their water from wells, private wells and municipal wells. In my town, we have a combination of public wells and municipal wells. Our aquifers are contaminated. The PFAS action plan that the EPA put forward in 2018 it's very troublesome. You know, it sounds good. It's 20 plus pages of really good goals. The issue there is they focus on 4 legacy PFAS, and those chemicals are no longer produced and evidently no longer used. They're still there. They need cleaned up. Well, here's the issue here for my community. We are still breathing air from 13 unfiltered stacks, round the clock, 365 days a year. We have legal outfall, stormwater outfall, with at least 34 PFAS documented in alarmingly high numbers. Congressman Pappas, when he was elected into office, his staff had a great packet with me full of the test results, and they looked at it and they said, these numbers are really high. This is outrageous. The discharge into rivers and brooks in the area, legally allowed, federally permitted. The groundwater, which is our drinking water, that continues to bioaccumulate, and let's not even get into the health studies we don't have, or blood serum is full of these chemicals. We have health effects, and it's legal. So this company can look you in the eye and basically say, we're following the law. So the New Hampshire MCLs, which are leading the nation, they're very, very important, focus on 4 chemicals that are in our water, but we have other ones that are there in higher amounts. They're basically invisible. So I led a health study in 2017, went out and gathered our own health data in this community, and residents who gave of their time and energies, who came and went out to their neighborhoods and recruited people to fill in these forms. We took it to the state, we took it to everywhere we could, and basically nothing can be done about it because all of this is legal. We find multiple health conditions that are known to be associated with PFAS. Our community shows that not only do these health conditions occur at lower levels than recognized by the federal government, but the cocktail that we're drinking, what is in the current manufacturing stream. We know from EPA non-target analysis that there are 190 PFAS coming from this facility. 190. And here we're talking 5 to 7 years for the EPA to, get their together, and I bleeped myself right there, and regulate PFOS in PFOA. It's absolutely outrageous. And sadly, it has become a political issue, and it has to be, because the laws are not there to protect us. And the harm, if the harm could have been halted in 2016 when we found out about this and we stopped the source, we still would be impacted, and we'd be impacted forever. But the harm has continued. That is beyond a disgrace. It's an insult to every American like myself when you find out you are being actively contaminated without your consent, and it continues day after day after day while people squabble over how much is enough and how much is too much, and you can't really prove it. How do you know it's, not something else? And Andrea and I have worked in a national PFAS contamination coalition with members from across the nation. And one of our goals is really to make sure that our elected officials are educated, not just about our stories. Our stories are mind-blowing when you hear them in detail, but also to understand what this looks like on the ground. So the legislation really matches the needs of communities and really does address what's happening currently.
And so, Laurene, I know we're getting a lot of questions from our Facebook audience. One is for Congressman Pappas. Just tell us, what will your bill do to turn off this tap of pollution, and in particular, what can Congress still address this issue in the time that you have left this year?
Well, we absolutely can. And our bill has already cleared the House, I think, 3 times on different pieces of legislation. And so, we're focused on the issue of industrial discharge and regulation under the Clean Water Act. This should really be common sense. I mean, as you mentioned, Scott, the framework is here, and we just have to add, PFAS to the list and make sure that our EPA is doing everything it can to prevent industrial polluters from making this problem even worse right now, and preventing them from just passing it along to public treatment works, and along with that, passing the price tag along to local ratepayers and taxpayers. So this is maddening. I think we do have an opportunity with the Water Resources Bill. We'll look at other must-pass bills, including the National Defense Authorization. We've been able to secure advancements in addressing PFAS through that in the past, including banning the use of AFFF firefighting foam. That's the culprit at these military bases. So I do think there is a window of opportunity here, especially in December when all the kind of end of the year legislation moves. And we're on the record in the House with a strong bipartisan vote behind this provision. So it's a matter of, when and not if. And we just got to make sure the when is as soon as humanly possible, because the contamination is active, and we've got to stop making the problem worse first. And then we've got to make sure we're addressing the cleanup, the long-term health issues, and making sure that people are taken care of. But I think the interest in these issues is going to live well beyond this Congress. I think we are building tremendous support over time. And I do think this is, a year where we will see environmental policy on the ballot in November and people responding accordingly.
And Mark, we're getting a lot of questions just about what are the health effects. Obviously, it's something you're very familiar with. Can you help our viewers understand what are the risks to them from having PFAS in their water and food and ultimately building up in their blood? You're on mute, Mark.
I'll let you take some of this too, Scott, because you're the expert. But germane to this moment in time, we do know that PFAS makes vaccination much more difficult to be effective. And as we are coming out of COVID, we are going to need a population that has a vaccine that works well on them. And so there's an issue based on that. We also have it in our air. And so there's lung issues. People who are living in the shadow of PFAS air contamination are probably much more likely to be susceptible to lung diseases like COVID. Then we get into just what it does to the autoimmune system, making it weak, and then just the major diseases. So we know we have liver cancer. We have, there's some anecdotal connections to birth defects, low birth weights. We have Crohn's disease. And Scott, I know there's several others that I'd like to add.
Yeah, well, fortunately, we have 2 other experts, Andrea and Laurene. Do you want to add to, you're both deeply knowledgeable about some of these health effects?
Yeah, I think Mark definitely hit on the major ones that concern me, the different types of cancer, like kidney cancer, testicular cancer, the effects during pregnancy, and but I think also the immune function one, you hit the nail on the head with that. As we sit here and face a global pandemic and everybody's excited about a vaccine coming down the pike at some point, people in PFAS impacted communities take pause and say, well, geez, is the vaccine going to work well for me? Or as we wait for a vaccine and we know that these chemicals can suppress our immune system, we worry, are our families more at risk to contract COVID? And if they do, are they at more risk of having worse symptoms or death? So it's definitely concerning. And I think one of the things that I really struggle with when I worry about the health of my own children is that PFAS affects multiple systems of the body, multiple tissues. So it's not like, okay, we'll just watch their liver every year and everything will be okay. No, it affects everything, you know, it affects multiple parts of the body. So I worry even my own children who are exposed at really young ages, at critical windows of their development. Okay, they're healthy now, they're 7, they're 9, everything seems okay. But what's going to happen 5 years from now, 10 years from now, when they start to have a family of their own? Will they have reproductive issues? I will never stop worrying about the health of my family because of how toxic these chemicals are and just how they affect every part of the human body.
And just by the way, they also move through the blood-brain barrier and also from the uterus into the unborn child. So even if a parent, mother is infected then with this poison, they're also giving it to their children. It stays in us for virtually forever, and it builds up in us. It doesn't. It's very hard to get it out of our bodies once it's there, and that's terrifying. That's a ticking time bomb in your body, in your family's body, and it's systemic. And so we don't really know what the chain reaction of diseases it might kick off within the entire system of a human body. I mean, this is a system that works in concord with every different organ, every different health system inside your body. And so we still don't know what the long-term effects are.
And a sort of related question that we've gotten is what can, I think everyone wants Congress to act as quickly as possible to reduce discharges and clean up legacy pollution and get PFAS out of these everyday items that we put on our bodies or put in our clothes or in our carpets and so on. But what can people do in their own personal lives to reduce their exposure to PFAS? What do you, Andrea, Laurene, Mark, what do you tell people when you must get this question all the time? What can people do to reduce their personal risk while we're waiting for Congressman Pappas and the Congress to hold EPA's feet to the fire?
In our community, we encourage people to filter their water at a minimum of point of use system. Reverse osmosis on your kitchen tap is under $200. Hopefully you can find someone to put that in for you affordably. Whole house systems are a little bit problematic, but they can be used also. We don't want to just rely on bottled water. You know, the plastics and some of the quality has been there. But the other piece is not to be fearful. There are health conditions that are very troubling, but they can be monitored. So you need to be your own advocate to your physician. You need to watch reproductive health, neurobehavioral, immune functioning in particular, and really advocate for more comprehensive physicals and maybe some blood work in the teen years, because kids have a variety of issues that you would not be looking for at younger ages. And these are things that can be managed. So unfortunately, they're there, but we can manage them with vigilance. So be vigilant. And stop the exposure.
We have time for one more question, so I'll just ask Congressman Pappas, what can we be doing? What can Congress be doing? What can all of us be doing to make sure this remains a priority for the next administration?
Well, we have to make sure we have an administration that will make it a priority. And, you know, we've seen veto threats of pieces of legislation because PFAS was attached to it in the past, which is just mind-boggling, that we wouldn't want to do everything we possibly could to clean up our environment, to protect people's lives, and to lean into the science. So, I mean, I think it all comes down to conversations like this. It's, you know, advocates and activists who are understanding what's present in their communities, bringing this to the attention of policymakers. And I really just think it's a matter of education. If we can get the information out to some of my colleagues who, you know, just frankly haven't heard about this yet. We know that it's in every congressional district, so that's not the issue. It's just an issue of identifying the hazard that exists, identifying the active contamination, and making sure people are informed about it. And I think the most powerful voices in the room are those of Andrea, Laurene, and others around the country that have been directly impacted by this. So, you know, from my end, we've got to be keeping an open mind and listening to our constituents who are asking for this because this is a clear and present danger. And until we get EPA to act, until we can put more stringent policies in place that are based in science, the threat continues. So I think it's all about lifting up these voices, making sure they're part of the conversation, and educating members of Congress who, have been focused on a lot of other good things maybe, but just don't have the background yet on this issue.
Great. Well, that's all the time we have today. Want to thank our local advocates, Mark Ruffalo and Congressman Pappas, for your amazing leadership. Thanks for joining us.
Thanks, everyone. Take care.